6:44, time for your health check this morning as news about COVID-19 infections continue to get worse as the local numbers continue to go higher. Our North Texas leaders say they are looking for ways to turn it all back in the right direction. So to join us now with perspective is Dr. Huang, Director of Dallas County Health and Human Services. Dr. Huang, I appreciate you hanging out with us this morning, but look, the numbers certainly going in the wrong direction. Do we need a statewide mandatory mask requirement?
You know, we've really had more evidence, more scientific evidence that if everyone masked, that would make a huge impact on our numbers and on the spread of the infection. And so whatever it takes to really compel people to do this. I mean, it protects, again, it's really how to protect our neighbors and our families. And if we all do it, it's probably one of our safe ways to open up the economy.
Well, Dallas County Judge Clay Jenkins wrote a letter to the governor's office talking about the state implementing another stay-at-home order. That's certainly another way to slow the spread. How do you feel about that idea?
You know, I think it was for a limited time, recommending for 30 days. But, you know, the definition of that stay-at-home order was more refined. We've learned some things from our prior experience. It wasn't just a total shutdown, but really defining, you know, it's still if workers can do teleworking, keep doing that, do these other things that we've learned how to practice the 6-foot physical distancing, but get that universal masking as part of that. But there are some particular areas where, you know, and the governor has already shut down the bars, limit the outdoor crowds to 100, indoors to 10 or less. You know, those are some of the practices that we think, you know, going back for 30 days would help us control this. But it's not a total shutdown. It's really in a controlled way based on some of the things that we've learned.
We've reported on some of the long wait times to get test results, people waiting up to 10 days. It feels like that almost defeats the purpose. Why have those results been delayed so long?
You know, what we're hearing just nationally, there's just huge demand for the test. It's really stressing some of these laboratories. So that is absolutely concerning because for the test to be really helpful, that we do need a quick turnaround.
I want to get to some of the questions that our viewers submitted. One said, I just tested negative after testing positive 3 weeks ago. Do I now have antibodies that will protect me from getting sick again?
You know, we're still learning about how much prior infection is protective. So, you know, there's more to learn because, you know, then some people have these persistent positive tests from some of the RNA that might be being detected. And then it's been shown that that's not necessarily causing infection. So there are various things regarding that that we're still learning.
Another viewer wants to know, this person's got 2 HVAC repairmen that need to enter this person's house. Should they ask those repairmen to wear masks?
Yes, absolutely. Again, what we're really recommending is that universal masking, especially if you're going to be with any proximity. You know, we want to keep practicing that 6-foot physical distancing, but universal masking also is an important thing, as well as washing your hands and not touching your eyes, nose, and mouth.
We've seen the numbers, we've seen the curve spike back up again. How dire is our current situation?
You know, we have regular meetings with the area hospitals, local infectious disease experts. The numbers are getting very concerning. If it keeps going up at this rate, it's really alarming. And again, we need to take this very seriously.
Okay, we will. Thank you very much for your time this morning, Dr. Huang.